to talk about, yes, breast cancer, but I thought it's only fair if we talk about cancer in general a little bit, so that we have sort of a basis to understand, breast cancer when we talk about it specifically. But I thought, the other thing is that I have a cancer survivor that is joining us. She's a retired midwife that is a survivor of breast cancer for now 20 years. And so when she comes in, she will be able to have an experience to share with all of us, and hopefully we pick, lessons from her experience. So I wanted to first let you know I was officially invited to come to give this talk, and in the letter to speak to our patients about breast cancer, awareness, prevention, lifestyle, and possible treatment. And then it's also a desire to have a breast cancer survivor who will speak to the women. And I want you to emphasize this. Breast cancer is not a cancer for women. Mm-hmm. Men also suffer from breast cancer. And it's important that we all note this, because many people out there think breast cancer is a cancer that only women can suffer from. 1% of all patients with breast cancer are men in the world. And unfortunately, men usually come very late when they develop breast cancer. Because one, I think many of us don't think we are candidates when we are men. But also because the breast tissue for men is small, there isn't room for breast cancer to advance locally before it spreads to other parts of the body. I don't know whether that makes sense. But regardless of your background, I'm sure that down the road we'll all be on the same page, understanding what cancer is and and being able to understand when we talk about breast cancer specifically. I'm trying to make sure I don't block anyone from the screen, but also to make sure that I can see all of us. I hope this is a good place. Was your camera focusing on me? Yeah. But you're the one who positioned it. So I just wanted to begin by telling you that I wanted us to go, our bodies are cells. The way this house is built by bricks, I hope they are bricks. Some of them are blocks, some of them are, concrete pieces that are put together. But many of our houses, we know the bricks that build a house. So these bodies are made up of bricks, which are cells. And so our bodies contain trillions of cells. But when they come together, they are able to form what we call a tissue. Then the tissue forms an organ. Then the organs form systems. Systems form us. I hope that is clear. And when I talk about a system, I'm talking about the heart and the blood vessels. That is one system that connects and works together. And so is the central nervous system, the brain, the spinal cord, and the nerves. Just for you to appreciate that. So for cancer to develop, usually, it's a cell that becomes abnormal or becomes a cancer cell. So when it becomes a cancer cell, it produces other cancer cells like itself. And what results is now a mass of cells, or an excess number of these abnormal cells, which are actually cancer cells. And so a person suffering from cancer is going to have a swelling, which is actually a mass of cancer cells. Is that clear? I want us to really be together, at least from this point, so it is easier for us to understand when we talk about cancer of the lungs, cancer of the intestines, cancer of, then in that kind of cancer, what happened exactly. I hope that is clear. So when this change happens in the bone marrow, where blood cells are made, what results many times may not be a swelling, but an excess number of these abnormal cells in the bloodstream. And so when somebody comes with symptoms of blood cancer and we test their blood, we are able to have an indicator that this blood could be having leukemia. We go ahead and examine the bone marrow and then confirm that actually the cells in the bone marrow are abnormal. And then we say the person has blood cancer, which is called leukemia. So in leukemia, many times there are no swellings, but there are abnormal cells in the bloodstream which come from the bone marrow. Again, I want this to be very clear. Many times as health workers, we see somebody has a tumor, and many times we call leukemia as tumors because that word is synonymous with the word cancer. But for common use, the word tumor refers to a swelling. So if you're a health worker and you're talking to a journalist, don't care if they say tumor to the disease. So one, remember, for a cancer to evolve, it's a cell that becomes a cancer cell. And that change of the cell into a cancer cell, we actually call it carcinogenesis. That process is called carcinogenesis. But it's important for somebody to know that someone will have no cancer and at some point, the cancer will evolve. So this process is called carcinogenesis, or what we call malignant transformation of the cell. Is that clear? So again, when this cell becomes a cancer cell, there are three things that can happen. The immune system of the body, the abasirikalevo mubiri, binds okorachi to destroy this cell. And so the person who becomes a cancer cell, it can actually die. But also it can produce other cells and eventually the person develops cancer. But in some cases, it can actually kind of be stunted. Let me put it that way. So somebody can have a cancer that is indolent, that is just quiet, and waits for certain circumstances to happen, and then the person progresses to present with cancer. And that explains why some people with 3 years, 4 years, even 5 years, they are there. Because our bodies are different, and for cancer to progress or to grow, it needs certain factors in the body that need to be present. The same applies for cancer not to grow. Certain factors need to be present to slow the progress of the cancer. Because I think I have it. Maybe those slides, I will leave them and just come. I thought I should just give us a picture of the cancer burden in Uganda. Because I want to tell you that if you're in this room, you're one of the few lucky Ugandans that is able to participate in this. There are not many people that will show up even when you call them. We don't yet as society value information and knowledge. Yeah? But it's also possible that we are still struggling with many things. So, I want you to just pay attention to this. Maybe this is these are statistics for 2018. 17. 32,617. You could divide this by the district and see what share each district has, or even by the counties and see what share each county has. And then the number of deaths was 21,829. These are the number of people that died. And if you calculate percentage, this is definitely about 60%. Meaning that we lose 60% of the people that present with cancer. But the total number of people living with cancer in Uganda over the 5 years, you can count 2012, October is an awareness month. And it accounted for 7.1%. And you could say that cervical cancer almost triples, you understand? So and it's a cancer that we can actually stop. It's a cancer that we can stop. Now we have vaccination. As a government, because people will be, is it 9 years, is it 10, is it 11, and then there was confusion. And also I think there was a message of P5, P4, that also confused when somebody gets the first dose when they are in their third term of P4 and they go to P5, do they cease to qualify? So why we say 10 years is because then every 10 years should go. And the moment a 10-year goes, then they are told when to come back for the next dose. But the next dose is usually given after 6 months, but within a period of at least 1 year. So if somebody delays and they come in the next 6 months, we can still give. If it's beyond 1 year, then we start again. Again, that is clear. To affect their immune system, they reach a point when they are very vulnerable to many infections that we call opportunistic infections. So when they are at this point, we say they now have AIDS. Are we together? Because AIDS is acquired immune deficiency syndrome. It means that a syndrome is usually like a cocktail of many symptoms. So in this case, their immunity is so weak that it's very easy for them to develop many diseases that many immune competent people do not develop. Are we together? So when we say a disease is AIDS defining, we say if somebody has HIV and they have that disease, then we say they have AIDS. They should be treated like somebody who is severely sick because of the HIV infection. Are we together? So I want you to note that cancer number 1 is AIDS defining, cancer number 2 is AIDS defining. Meaning that also, if we control HIV AIDS, we could actually prevent many of these cancers. 2 things that I have mentioned. If we can prevent cervical cancer, we can save many women, save a lot of resources, save our country from a lot of distress. If we prevented HIV, we could actually also save ourselves. And also, cancer number 5 is actually AIDS defining. And these are actually the 3 leading AIDS defining cancers. Cervical cancer, Kaposi sarcoma, and non-Hodgkin lymphoma. I think I leave that one at this point. I think that is also a good foundation for us to understand. But I also thought it's good for me to make mention of this. That there are more than, can you see this?
Yeah.
So I don't have to go in slideshow. I wanted to mention that there are more than 100 different types of cancer. This 100 is really to dramatize the whole statement, that there are many different types of cancers that we cannot enumerate them here. But we usually name cancer according to the cells, according to the cell that first became cancer. What I mean to say is, if somebody has breast cancer, they can come in the hospital with a swelling in the liver. But this swelling is because of the breast cancer cells that moved from the liver where the cancer started, from the breast where the cancer started to the liver, which now becomes a secondary site for the cancer. And when the swelling in the liver is there, they'll come with complaints of a liver swelling. And then when we examine, in case the breast was free, then we confirm that these are actually breast cancer cells, but in the liver. We don't say this person has liver cancer. We say the person has breast cancer. And we treat it as breast cancer. Because primarily the cells that are cancerous are what? Breast cells. Does that make sense? So that's why we have breast cancer, cancer of the cervix, cancer of the prostate, lung cancer, mention any part of the body. But I want to remind you also that there are some cancers that are named according to the appearance of the cells, according to the change of the cells. So you find cancers that are called carcinomas of unknown origin, because the cells look like a cancer that is called a carcinoma. But that is not a subject for today. But to let you know that there are many cancers, cancer is not one disease. And that's why when we are treating cancer, patient A may not be treated the same way that patient E is being treated. because they might have different cancers. But why I'm saying also cancers are named according to the cells, to the way the cells appear, is that some cancers can be treated differently because the change that led to the cancer is different. What I'm trying to say is that you can have somebody with breast cancer being treated differently from another person with breast cancer because the biology of the way the cells are in these breast cancers are different. And therefore the drugs that work are what? Are different. Is that clear also? Is that clear? Yes. To everybody? That you can have the cancer in the same organ, the breast, but patient A is being treated different from patient B. Because when we examine their cells, we found the cells are actually different. And the drugs that work are different. And therefore also the chances of cure are different. I hope that is clear. Meaning the cause of the disease is not going to be the same. I hope that is clear. Excellent. Then, I think I have a slide on cancers in children. Children also suffer from cancer. Many times, we never think that children can suffer from cancer. And for you who are working in a hospital setting, probably there are people who are from the community, but who are working in a hospital setting, this is obvious. But it's not obvious to the policymakers, to the politicians, and to our community members. So when a child has complaints, cancer is not one of the things that the parents think about. Let alone the health workers. For a child to come when they are anemic, and then this health worker quickly thinks this could be a leukemia. Or for a child to come and say, you know, my child lost her tooth. And it's not time for her. She wasn't shaving her tooth, but one of her tooth, you know, just came out. Then you don't quickly think of Parkinson's lymphoma. Because the body of a child has an excess supply of growth factors. You know, I would say the body is in a growing mode. So anything that requires growth, just with cancer, chances the 5-year-old boy gets cured completely are higher than this 50-year-old man. Is that clear? What I'm trying to tell us that one of the suspicions on our minds when a child is unwell should be cancer. Because chances that we catch it early and treat it well, chances that this child survives are much higher. So we do them a disservice when it never crosses our minds that they could suffer from cancer. Because it will mean when they have cancer, we'll catch them late. Because we'll be dying, malaria, you know, out together. Yes. Yet when it's a man, people say, just ends up going already cancer. I hope you understand what I mean. Yes. So that's important. Then another important fact to know is what causes cancer. This is a very, very sad fact. That there are different factors that everyone has. And so when we talk about cancer awareness and cancer prevention, everyone should really because we are all at risk. I hope that is clear. Now the second risk actually that is I choose to be the biggest driver is age. So many cancers are associated with aging. So the older a person becomes, the higher their risk for developing cancer becomes. Again, that is clear. That there are some cancers that we see now because our life expectancy as a country has improved. You understand? And then, another risk factor is family history. And this risk factor is connected with the genetic makeup. So there are cancers that run in families. As a matter of fact, there are cancers whose responsible genes are now known. You understand? One of them is breast cancer, which we are talking about today. Another one is ovarian cancer, some types of leukemia, cancer of the colon, prostate cancer. Patricia. This is a survivor, maybe she wants you to direct her where. So again, if somebody has had someone with breast cancer in their family, they need to know they are at a higher risk. Now, other people who have not had it may not know that they are at a higher risk. You understand? I usually tell people that many of us do not know what our grandparents or even great-grandparents died of. You understand? So we cannot even claim that we know our disease family history. Are we together? But if you're privileged to know, then you know for you, your risk for breast cancer is high. Ovarian cancer, leukemia, I talked about prostate cancer, I talked about cancer of the colon. And then the history of having been treated for cancer. This is really trying to be gentle to this risk factor, but this is the history of having suffered from cancer. Because like we say, that there is a genetic predisposition. If somebody has had a genetic mutation that has made them suffer from cancer, chances that they could have another genetic mutation is high. So if somebody has suffered from cancer before, they are at a high risk. As a matter of fact, in cancer treatment centers, people who are treated for cancer continue to be seen in cancer treatment centers for the rest of their lives. Is that clear? At Uganda Cancer Institute, you have people who are very elderly and they were treated for cancer in the early 70s. They are there. They are now maybe 60, 80. And they still come. Are we together? And the reason for that long-term surveillance, as we call it, we are surveying the body for any signs of cancer, is so that if the same cancer comes again, we catch it early. If they develop another cancer, we also catch it early. Okay? Now, there are other risk factors that are very, very important. High onset of sexual activity and multiple sexual partners. This is a big risk factor for cancer of the cervix and cancer of the penis, because these cancers are associated with human papillomavirus infection, which is sexually transmitted. So if girls begin sexual activity at a young age, they are likely to catch this virus, and the longer the duration somebody has the virus, the higher the risk of developing the cancer. So some people will catch the virus but clear it. They get safe. But we do not know who is going to clear it and who is going to have a persistent infection. And then another strong risk factor is radiation. Exposure to radiation increases the risk for many cancers. This is important, like in areas where there is high energy emission, radioactive compounds, people who work in X-rays, people who work in cancer treatment, radiotherapy units, people who are living now in the oil mining areas, because as they mine down there, they are likely to get some radioactive compounds. So we expect that in the Albertine region, in the next probably 20 years, we may see leukemias going high. Are we together? And I think I mentioned here, also for the albinos, I think I mentioned it separate. Smoking is a risk factor for many cancers, and so is tobacco generally. Sniffing tobacco, using tobacco through shisha, smoking it, chewing it. I don't know whether there are drinks with nicotine. All these are risk factors for very many cancers, and I think I made an effort to list them, but the list is very long. And then exposure, unhealthy eating. Unhealthy eating is a risk for these cancers. Cancer of the bowel, stomach, breast, lung, prostate, including breast. A high-fat diet increases the risk for breast cancer. And I hope prostate cancer is there, yes. So we need to eat vegetables and fruits in plenty. Reduce high-calorie foods, which are mainly carbohydrates, and also reduce the fats. So the principle should be increase the vegetables and fruits you eat, reduce the meats that you eat, especially the red meats, And because this, I'm good for that opportunity. You understand? I am pretty Nsimba Katawa Kubanga, I can see people, you know. Yeah, but it's important, especially when you are an adult. Yes. Now, the other risk factor is too much exposure to the sun, especially for people of fair skin, but also people who are albinos. And there are people also who may have some moles on their skins. Those could be other, potential sites where malignant melanoma can develop. But too much exposure to the sun is bad. You have no business being in the sun if you can avoid it. Is that clear? Mm-hmm. Albinos are supposed to have big hats and also long clothes, long-sleeved, top wears and trousers to make sure they minimize the impact of the ultraviolet rays from the sun to their skin. Because the skin doesn't have melanin to absorb the ultraviolet rays, so the rays can easily destroy the cells of the skin and cause cancer. I hope that is clear also. Now, the importance of screening. I said I want you to talk about the cross-cutting things that I think are very important. Later on, we'll dive into breast cancer. I hope we will have time to sufficient to talk about it. So, screening, listen, she had a massive stroke, she fell down dead. They buried yesterday. You understand? So that's why screening is important. That each one of us here should know their blood pressure. You're doing yourself a disservice not to know your blood pressure. Totally. I'm sure there's a blood pressure machine. Is there one? Yes. So before you go home, know your blood pressure. Or let's say before this week ends. Okay, before Independence Day. But I had a meeting walking back to office. Do you understand? My chairperson was walking out of the house to go to do her business. So, screening looks for early signs or indicators of a particular disease in healthy people who are not feeling sick. You understand? So you are okay and you're saying, doctor, check me. Could I be sick? Or could I have a disease that I don't know yet? Are we together? That's all. So you don't have to wait for anything, headache or fatigue or whatever. No. Now, for cancer screening, people can also be screened to determine their risk of suffering from specific diseases. So for cancer also we can do risk screening. We take your family history. Are we together? We take your nutrition history. We take your lifestyle history. Whether you drink alcohol, you use tobacco, you also go somewhere to screen them their risk for breast cancer. So that we don't just screen for signs of breast cancer, but also screen for risk factors in them, and we can advise them how to reduce the risk factors or even avoid them completely. Okay. So I think I don't need to go through screening. That is clear, but these are the cancers we can screen for: breast cancer, cervical cancer, and I think now cervical cancer comes here, prostate cancer, cancer of the bowel, large intestines. We can also make an effort to look for signs of malignant melanoma in the skin. I think this is very modest. Now for people like the Dinkas, whose skin is very dark, it may be very difficult for you to look for dark spots on their skins. Are we together? But also interestingly, their risk also for malignant melanomas is what? Is lower. Because they have enough melanin to absorb the dangerous rays. So don't wait until when you're sick, This is really personal information. Now, I also wanted to emphasize this, because there are health workers here. Some tests can indicate the possibility of cancer, but a screening test being positive doesn't mean that somebody is suffering from cancer. Are we together? There are places we go to screen and health educate, and people come and they're lining up, Munjanjabe, Bangama Dina cancer, because they did a VIA. The VIA was positive, and they told them you have cervical cancer, which is bad. You examine a woman's breast, there's a lump in the breast, you say you have breast cancer. That is very, very wrong. So a screening test being positive does not mean somebody has cancer. A screening test needs to be taken further for a confirmatory test. Are we together? And at this point I must mention that when we do tumor markers, first of all, tumor markers are not supposed to be used to do screening. Now, if you're not a doctor or a nurse or a health worker, you will not understand what I'm saying. But tumor markers are tests. Tumor markers are substances that we test in blood to see whether there could be a certain cancer in the body, or there are changes in the blood that are associated with cancers. So if somebody's tumor marker is positive, it doesn't mean that they have the cancer, because there are other things that can actually change the tumor markers. So if you're a doctor diseased from ordering for a battery of tumor markers, CEA, PSA, you know everything, all the tumor markers that a lab can do. Because that's wastage of money and also wastage of time. And then I also wanted to mention that cancer diagnosis is confirmed by biopsy. In our sitting here, we confirm cancer diagnosis by biopsy. Yeah? Or another way to put it is biopsy is really the gold standard for cancer diagnosis. Now, cancer treatment it is. And if we go specific, in 2018, there were 2,318 people diagnosed with breast cancer in this country. 2,000. I am stopping so you can reflect on the figure. So it's not a small number, you know. Let's go back to know about breast cancer. One, to know that everyone with a breast can suffer from breast cancer. A man, a woman. Are we together? But you need also to know the breast, how it is, in order to know how to, to check yourself. The breast has what we call the nipple. The areola is the dark area around the nipple, and then the rest is the bigger part of the breast. But also, when you go further, the breast has lymph nodes on Sanjavavu that we need to look for when we are checking for signs of breast cancer. So some of the collarbone here in the supraclavicular fossa, if you're a Musau and you know that anatomy. So when we're examining for breast cancer, we must make sure we deliberately look for lymph nodes in the armpit, and also look for lymph nodes above the scapula, the clavicle, and also look for lymph nodes in between our breasts.
Here, go and tell the doctor is something here. You come, that is half of the breast. After half of the breast, we come to the 3/4. The 3/4 is down here. You examine like that. After that, we come to the whole of breast. All of it, you examine this part which is left. Come, examine all of it. After examining all of it, you squeeze the nipple to find out what is coming out. If you squeeze and you find there is some brown blood coming out, please go and tell your doctor immediately. If there is milk or there is nothing, it's okay. Okay? And I have brought something to show you that color, how it looks like. I think you will go around all of you and you feel it. It is inside here. The way I have been examining, you examine and you feel that cutting which is hard. It is inside here. Then after that, after examining this one, and this is the, as I will tell you, the bra which we put on is special. It is this one. All of you will see it. It will go around and you see. It is not the ordinary bra. This one. Okay? The same as we have done this. You do the same. Okay? I think that's all.
So what Josephine is saying is that, is really appropriate. It could be a Sunday morning, it could be, I do not know. But a day that you know is appropriate, you're not going to be in a hurry. It doesn't mean if you miss, then you miss, but you can do it the next day. But it's nice to have it on your calendar. And one of our health educators used to say, know the status of your breast. So that any time you know how your breast is. If there's any change, you will know. Is that clear? Excellent.
Another one? Okay, now my story. As I said, even doctor said, I was sick in 2000 February. So when it reaches February, I make another year. Now in February this year, I made 20 years. And I thank God for my life. And last Sunday on 4th October, I made 70 years.
Of age.
So I thank God for my life. How I started. I was examining, I'm a retired midwife. I was examining my breast. The lump I felt is the lump which was under, after the nipple under, the 3/4 part. When I felt it, and my breast had become bigger, and it was shining more than the other one. So I examined, I felt it. I told my best friend, she's also a midwife, I told her, I'm feeling something hard. She examined me. She felt it, but she said, I'm not feeling it. I told her, okay. So the following day I went to hospital. When I went to hospital, the doctor I saw told me, Josephine, you go to the big hospital immediately. I told her, doctor, you have made me scared. I said, you go. I didn't go that day. I went back home. I'm a widow. I went and told my children, doctor has advised me to go to the big hospital. So I went home. My neighbor said, we'll go with you. They had also told me to go, and I have not gone. So we went with her. Before the exam, like the one we do in Mulago, they teach us how to examine your breast, if they find when you have cancer, what to do. So the doctor talked to us, we went back, mammography, both of us with my neighbor. And they told us, long ago we used to go back after 1 month. When waiting for that 1 month to be over, many people came to my house. They told me, basically, don't you agree to remove your breast because the woman's life is in the breast. You are going to die. Others came, one came and said, my sister died of cancer. You are also going to die. And another one said, let me bring somebody to pray for you, and the lamp will go. Another one said, use this medicine from China, Tianzi. When you take a Tianzi, that thing will go away. You know when you are sick? I went and every week you go to Tianzi, I buy the medicine, I feel the thing is there. Somebody came and brought somebody to pray for me. He prayed, he said the thing is gone. I touched, the thing is there. So after 1 month, I went back after spending money for Chelsea, all the advices I took. But during that time, there is one lady who came, removed my breast some years ago. And I was seeing her with the breast. So if they say you have cancer, I agree they remove that breast. She's the only one who encouraged me to remove the breast. And so after 1 month, we went with my friend. When we went with her, she's the one who entered first to see the doctor. She told me, Josephine, for me, I don't have cancer. And may her soul rest in peace. She died 3 years ago. She didn't have cancer. For me, when I went, in fact, when they gave us the results, mine was in an envelope, hers was just plain. So, but I didn't think that it is in an envelope because maybe I'm positive. He told me like that. He discouraged me very much. But I cried a lot when they told me I am going to die, and you know, my children, I'm a widow, my children will be left alone in the world. And I took a photo with them. I took a photo with them, and I took a photo for put on my coffin, and also my children to stay with their photo when I die. And that photo is in my house, and I gave them, all of them, a copy. And now, after that, I went and they told me, now you have to see a surgeon to remove the breast. I told the surgeon, they told me to remove the breast. I cried. When they tell you to remove the breast, you really feel as a woman. But I cried, but I was having faith. Faith that I will be okay. My breast was removed. When it was removed, I was not very sick, I'm telling you the truth. They removed the breast very early. I was the first patient at 8 in the theater. The following day, I went in the bathroom and cleaned myself. After that, the breast got healed. It got healed after there was a small heal, but after a small hole, but after that it healed all. They told me my cancer was grade 3. So I was going to get chemotherapy and radiation. I got chemotherapy. Chemotherapy, when you have a patient, becomes very big, you become very dark, the hair goes off all. But my hair came back, but I'm used for a wig. My hair came back, it comes back after, when you stop chemo, it comes back. I got 60 chemotherapy doses, normally they are 6. I thank God, and I told God not to make me get that chemotherapy again. It was very bad. So after that, I was getting every 3 weeks, you got to get a dose. And they don't give you chemotherapy when your hemoglobin is below 10. So I used to eat fruits and drink a lot of water, enough water. And every time, when you are going to get chemo tomorrow, you go for checkup today. So the following day, just go for chemotherapy. Every time they were checking my hemoglobin, it used to be above 10. And I got my 6 doses without breaking. Every time I go, they check after 3 weeks, I get a dose. So I got those 6 doses every 3 weeks without any break. Then after 5, because they don't work, government people don't work on Saturday and Sunday. So you get it Monday to Friday, 5 doses. So I got 25 doses, and I was going every day, Monday to Friday, I think those are 5 weeks. And I finished all of them. I was weak. I was weak even when I could go to the bank and they could give me a chance to go fast. Because I was looking weak. But when you have trust in God, and I'm grateful and I thank God. One day I woke up and I felt energy from down, it came up. I'm telling you the truth. The energy from that day, I started having energy. And for me, even when I go anywhere, they say, Mama, you are strong. I think if at all I didn't become sick, I could be a very strong woman. I'm strong, I have enough energy to do my work. I can do my own things and get some little money for my income. Even during this time of COVID, I got another presidency because we teach people that don't use the capoeira. And when we tell them, doctor, that don't use capoeira, I started making something not to make capoeira, which they teach on Bukoto. I cooked it and I started making this, which makes to light the charcoal. And it lights very well, not like the capoeira. You just put on the fire and it lights. It is very good. So, from there, I started my life. I'm okay, I'm strong. Yeah, that is my story. Now I go to Dr. Mugisha after 1 year for checkup. Every February, I go for checkup. They tell us to go for checkup every day. And when I go, I'm okay. Yes.
Thank you, Fertility.
Another hand clap. Yeah. So thank you very much, Josephine.
And I brought this magazine from our office. We have an office called Bukoto for breast cancer survivors, but we sell them 5,000 each. Okay, thank you very much.
Thank you very much, one, for being attentive, and Josephine, thank you for coming. Josephine believes it won't be possible, but I'm glad she was able to come. I think some things that you should take note from her story. She thanks God that on all her treatment days, there was no public holiday. You know, even when we are treating cancer, I want to make sure we are on time. You know? And that's why we want our cancer patients also their HB to be normal so that we can give them treatment. Sometimes if the HB is low, if the blood is little, we postpone treatment. That is not good for treating the cancer, but it's good for saving the person. Because if you go ahead and treat them, you can eventually be destroying the person instead of destroying the cancer. That's one. Then number two, you notice that she had surgery, she had chemotherapy and radiotherapy, but she also took, did you take tamoxifen?
Doctor, when they started, I started tamoxifen, but after 2 years, they started my status.
Yes.
And it
So,
was negative.
so we started her on tamoxifen. Tamoxifen is a hormonal drug. We started her on hormonal drug when we weren't able to test for the receptor status of the tumor. When we got the capability, we tested the tumor. Remember, the tumor had been removed how long ago? But we went for that tissue and tested and confirmed that she didn't need tamoxifen because there were no receptors. That's why I was saying that some people will get hormonal.
Yeah, that is excellent. So why we avoid, now listen carefully, because this is like a public health principle. Things that
So
are
ideally, she was actually given a package of
things that are
surgery,
being
chemotherapy,
implemented on a modern care level.
But hormonal therapy was given
When we are
together
giving
because we didn't have
health
a
education talks,
know whether it was healthy.
we avoid
And
that.
at that time we give it
Because
one,
usually the integrity of what happened
which was the first expense,
is not as important as the benefit
just give everybody.
of marketing a certain service. So one, some contraceptives can increase the risk.
I also want to announce that cancer treatment at Cancer Institute
contraceptives
is
we use the
There are
combined.
some things that are paid for, but even those that are paid, those
can
are
be
waived.
risk.
If somebody agrees to go through the
Now
process.
this is the principle.
So if you have
that-
any people who, you know,
For instance,
are saying
women
in
who
a
have
stage
their
similar
menarche at a young age
and
what
stop,
else should I say?
we also have
menstruating
cancer
at a
screening
young age
at Ghana
at
Cancer
higher
Risk
risk
every day of the week, Monday to
cancer.
Friday.
And the understanding there is that the longer a woman's body is exposed to estrogen, the higher the risk of breast cells developing cancer. That's
I read
why
here a story of
pregnancy
somebody.
protects
We even have
reduce the risk of breast
women who
cancer
are breastfeeding
and
children
children
after
after
feeding
feeding.
one breast. Actually, one breast.
Because when a
one
woman is
child,
breastfeeding,
the second breast to breast
for many,
cancer.
there is estrogen
You
comes
know,
out.
so it's a
And
cancer.
when they are
that-
pregnant, also their hormones
and
are.
the treatment can be
And the more they
very
do
aggressive
this,
and
the
difficult.
more they
Emotionally and
reduce the exposure of
You
their
know,
breasts. Breast
I didn't know that she took photos
on
on her
for
coffee.
the rest of the risk.
And those the photos they
I hope, especially for the side one, you appreciate that. So usually if somebody is doing something,
So thank you very much. I want to get that we stop here.
seemingly,
Because I still have work to do.
that increases the risk.
Thank you very much. Any questions, please?
Does that make sense?
Yes.
I know this hospital deals with a lot of
Yeah.
hormones.
Yes. Yes.
I have a question. So given the fact that breast cancer is increased in terms of family and also genetics, why do you advise genetic screening for people who have had increase,
Yes.
who come from
The
families?
answer is a strong yes. I'll give you an example. There are many swellings that we have cancer swellings. That's an excellent thing. So if we had the capability and if have multiplied very fast, but that multiplication has a time when it stops. So these non-cancerous swellings grow and stop growing. But also the change in the cell is not a cancerous change. But when you're in the community there, you cannot know. You need to go to a responsible health facility
and you'll be able to be guided whether this is a cancer swelling or not a cancer swelling. Does that make sense?
What if the swelling is on and off?
So many times swellings that are on and off are either infection or it's a hernia. Some hernias come and go depending on where they are. My advice would be that person sees a qualified health worker.
Can hernia be in the head?
In the head, no. No, the swellings that are common in the head are sebaceous glands, because the scalp has some organs that secrete some substance that can cause them to swell. And then that substance, when the gets infected, or even when the sinus is full, you know, it's irritable, they squeeze it, it gets empty. But all those are not cancer. Cancer swelling is not come and go. Cancer swelling has come, it has come. You must treat it or the worst happens.
Instead it becomes bigger.
Of course, yes. Another question? And now I'm going to put a limit because we are taking long to have questions for come. Yes, Patricia.
Okay, doctor, I would like to know, is it possible for babies to get cancer through breastfeeding?
No. Cancer is not transmitted through breastfeeding. Understand this principle, please, that when somebody breastfeeds, even if the milk has blood from a cancer in the breast, those cells will go in the alimentary canal, they will be digested, nutrients will be drawn from there, and the rest will go out as poo-poo.
Okay.
You understand it? The things that can cause cancer are the ones that can cause a mutation of the cell, a change in the DNA. Is that clear? So the foods that increase the risk for cancer contain substances that can actually cause, either can be absorbed into the bloodstream, you understand, or can get in contact with the cells of the alimentary canal and can initiate that cancerous change. Yes. 1, 2, then the last question.
But I think I've heard of someone say a man had breast cancer.
Yes.
How is that possible?
So I mentioned at the beginning that for cancer we do not have causes for many cancers. We have what we call risk factors. Now some risk factors are so strongly associated with cancer that if you're in certain forum, you hear people say HPV causes cervical cancer. But I was also told by a health educationist that the public rarely understands risk factors. So for you to make them understand, you say not doing exercise causes high blood pressure. You understand? So where you hear people saying this causes cancer, sometimes the word is used just, I want to say clumsily, or carelessly, or loosely. But essentially, there are a few things, if they are any. The strongest risk factor is genetic. Some people are genetically predisposed. And I mentioned that we will rarely know our genetic past. We don't know, because many of us don't know what happened with our great-grandparents or even our grandparents. So that's one. Number 2, obesity and high-fat diet are risk factors for breast cancer. And therefore, exercise reduces the risk for breast cancer. And then alcohol is a risk factor for breast cancer. So remember, genetics, high-fat diet, meaning also physical activity and alcohol. Yes?
Thank you, Dr. Mugisha.
That is a very excellent question. So having a mass when you're a teenager does not mean anything to do with your risk for breast cancer. I hope that is clear. Adenomas, they are made by the milk glands, because at some point sometimes milk glands produce other milk glands in one area, and when that is combined with the fat tissue in the breast, it feels a swelling, and actually we can remove it. But that doesn't mean that increases that person's risk of developing breast cancer in their future. But I said, when you have it at home, you never know which is which. So the responsible action to take is to go to a proper health facility where there are properly trained health workers And that one I say with emphasis because there are many quacks in this city. Yes. You are the last one.
Developing breast cancer.
Yeah, that is excellent. So why we avoid, now listen carefully again, this is like a public health principle. Things that are things that are being implemented on a public health level, when we are giving health educational talks, we avoid them because usually the integrity of what happens is not as important as the benefit of marketing a certain service. So one, some contraceptives can increase the risk for breast cancer, but the commonest contraceptives that we use, the combined, whatever contraceptives, those actually reduce the risk of breast cancer, yes. Now this is the principle that, for instance, women who have their menarche at a young age and stop menstruating at a later age are at a higher risk of breast cancer. And the understanding there is that the longer a woman's body is exposed to estrogen, the higher the risk of breast cells developing into cancer. That is why pregnancy reduces the risk of breast cancer, and so is breastfeeding. Because when a woman is breastfeeding, for many, their estrogen hormones are low. And when they are pregnant, also their hormones are low. And the more they do this, the more they reduce the exposure of their breast cells to those hormones, and therefore the lesser the risk. I hope, especially for the Basa who are here, you appreciate that. So usually if somebody is doing something that is going to increase, like hormonal therapy, that prolongs how long the person is seemingly in a productive age, that increases the risk for breast cancer, for ovarian cancer. Does that make sense? Yes, I know this hospital deals with a lot of hormones. Yes.
I have a question. So given the fact that breast cancer is increased in terms of family and also genetics, when you advise genetic screening for people who have had who come from families, and you advise prophylactic mastectomy? Because I've seen people ask that.
That's an excellent thing. So if we had the capability and if we could afford, that would be the best. Yeah. That if you have, the other women in the family, say who has the black gene, you understand? Because that gene has been identified to be responsible for breast cancer. But on a public health level, of course, I don't think there's any country that can do that. But in some countries, this service is available and you can pay for it. The same applies. I mean, there are people who reach a certain age and they have their breasts removed. So they can minimize their risk of suffering from breast cancer because breast cells are mainly here. They may be somewhere else, this is where most breast cells are concentrated. So if you reduce the number of breast cells on the body, you reduce the risk. Remember we said it's one cell that becomes cancerous and produces others. So if you reduce the potential of the cells to become that cancer, you are therefore also reducing the potential. Thank you for that question. Except if I come again. Thank you once again. This is important because COVID-19 is now all over our town. So things you must observe kindly, because I know that the public, I think, hasn't been equipped enough. Avoid coughing anyhow. If you're in people like here and you want to cough and you can control yourself, first go out and cough from there. Then you come again. And when you come again, wash your hands or sanitize before you touch things. If you have been here before you go away, either wash your hands or sanitize. Avoid touching your eyes, your nose, your mouth, what we call soft parts. That would mean including our private parts without washing your hands. You can actually avoid it if you wash your hands, and when you are in a crowd like this one, wear your mask. Because some of us, as we speak, some saliva comes out. You understand? And then I think the government also has decided that if people are positive, they are not admitting anymore. You self-isolate at home. So these practices become even more important when you know you're positive and you're at your own home. You can actually keep your home members safe by, avoiding coughing where they are, keeping alone most of the time. If you must show up, you make sure you are masked yourself, you are not touching, and many can be positive. And this has happened. I think at Cancer Institute we had a theatre nurse test positive, but all our theatre staff are free. Yet they were working with her, this time. Meaning that actually if you observe the precautions, you can actually avoid it. Yeah, we had suspended surgery for this week, starting Monday, but the results came yesterday and they are all negative. We fumigated on Monday, so after this week we will start. Which is nice. I'm just narrating that example to know that if you observe these precautions, actually you can be free. And you can keep your loved ones and your close contacts safe. Thank you. I'm saying that because I'm on the task force for Uganda Cancer Institute. I don't want to go away with important information. All right, God bless you. Thank you so much.